What about our lovely doggos? So let's move on to hypothyroidism. So what actually is hypothyroidism in dogs?
It's typically immune-mediated destruction of the thyroid
Hmm.
gland, which is relevant to diagnosis because we've got a lot of clever ways we can get there. It's a lymphocytic thyroiditis, inflammation caused by lymphocytes. I think eventually you get atrophy. Maybe sometimes you just get atrophy. Mostly middle-aged, older dogs, medium to large breed dogs, mostly,
Yeah,
I think is fair to
yeah, I
say.
think so.
Yeah.
Yeah, I think it's that lymphocytic thyroiditis. I think they say that it's either that or this idiopathic atrophy, which we don't really know why it's happened. Those two together make up about 95% of the cases you're going to see. But there are more rare causes that we can see, like thyroid tumors, congenital hypothyroidism, so birth defects, or damage from radiation therapy. But to be honest, they're much less common. So most of the time, it's going to be to do with the actual thyroid gland itself. And like you say, immune mediated destruction or atrophy. So, and when we were talking about T4 and T3 earlier, how does that fit here?
God knows. Well, it's less production of T4, therefore less T3,
Yeah,
presumably. Is
exactly.
that
Yeah.
where you
Yeah.
look?
So I think
Yeah.
it's basically reduced T4, which means that you get reduced T3. So slowed metabolism, and basically just everything slows down and you get weight gain because the metabolic rate is slower. It's basically how I think of it. So when we talk about that in terms of a clinical scenario and sort of the classic signalment that we're going to get, you've already said you're possibly larger breed dogs that are maybe middle aged, maybe like 4 to 10 years, depending on breed. What are we generally going to be seeing clinical sign wise?
I was going to say, it's just like it's cousin disease. Can we call it cousin disease Cushing's? I don't know. It's just that both those diseases are come on gradual over months. They kind of sneak up on you and they both involve weight
Mm,
gain, which is kind of unusual for a disease,
mm,
isn't it? So that's why I kind of say that. But obviously with Cushing's, you've got lots of thirst, therefore drinking a lot, weeing at night, weeing in the house, urinary problems. So that's the Cushing side. But the thyroid, low thyroid, you don't have any of the increased thirst. You don't have that side of things. So it's coming on gradual. It's weight gain. It's owners that are trying to diet their dog and they're not succeeding. And then eventually, if left for quite a few months, which is common, you get the dermatological
mm.
changes, which is they come in with like a patchy alopecia on their flanks or on the tail, rat tail on the
Yeah.
tail. And sometimes in the exam, you can just pull the hair out and make it even more bald. I don't know if you've done that,
Yeah. I mean,
but I've
they
done that a
talk
few
about that like
times.
tragic expression that they get as well, like the myxedema in their face,
Oh, yeah.
and potentially bradycardia. Sometimes they say infertility, but I mean, how are you going to know how many people are actively trying to breed these dogs because they're middle to older age? So I don't know. And they say
Yeah.
rarely
Yeah.
neurological signs. So in theory, it should be on your list for seizures. And sort of neuroscience in your middle aged to older dogs. To be completely honest, though, when I was in vet school, it got taught as if we were going to see these cases all the time. I honestly don't think I've ever diagnosed one in practice. I look for it, but I don't think I've ever diagnosed one. I've seen some that are on meds, but I don't think I've ever diagnosed one because every time I look, it comes back negative. So I just don't think it's anywhere near as common as we thought it was or as it is portrayed when you're in vet school.